For this assignment, we were tasked with determining the return on investment through evaluating correlations between variables in the Vista system. Specifically, we were to explore relationships related to information technology, or IT, its cost, and its outcomes. Information technology is already a critical component of healthcare. Current thought throughout the healthcare industry touts the great improvement that IT will have on efficacy, efficiency, and patient safety. Moving towards increased utilization in electronic health records is inevitable. It is, however, necessary to evaluate the role of IT in the financial perspectives along with the change in outcomes. To maximize utilization of IT, we must be forward-thinking. We must look at it as a way to change the way we practice medicine and deliver health care, not just as a better way to do the same thing. This involves thinking outside the box, all the while keep an eye on the bottom line, as fiscal responsibility is a crucial component to any business investment. As a healthcare administrator, it is imperative that an organization is able to track clinical indicators and evaluate relative data after the establishment of an electronic health record system like Vista. According to the Veterans Health Administration website, the mission of the VHA is to serve the needs of America's veterans by providing care, specialized care, and related medical and social support services. In order to comprehensively serve such a large population, the VA found it necessary to create a comprehensive electronic health database and implemented information technology into their system decades before any other healthcare organizations. Vista is the VA's integrated architectural database that supports the day-to-day medical functions at various VA healthcare facilities. Vista provides access to a patient's healthcare information, including lab results, imaging results, and computer provider order entry at the provider's fingertips. Millions of veterans and their families are served by this comprehensive, efficient, user-friendly program, with over 5 million patients being seen in it by the VA health system alone in 2006. In order to determine the value of the information technology investment the VA has made, we decided to evaluate 3 areas of the Vista system's healthcare record: the relationship between patient satisfaction, the cost of IT investment, and the cost of care per veteran were the 3 variables that we deemed significant and for which we could find or extrapolate data. We first determined the relationship between the variables. Subsequently, we utilized established equations to evaluate their correlations and any causality. We gathered initial data from the tables obtained by the Department of Veterans Affairs Office of Budget website. For patient satisfaction, we obtained actual data from the website for years 2003 to 2006. We used inpatient satisfaction scores only. Linear regression allowed for extrapolation to 2007 and 2008 score estimates. For the cost of information technology, we used actual IT costs for 2006 and the continuing resolution value given for 2007. We extrapolated estimated IT costs for 2008 using linear regression. The cost of VA care was determined by calculating per-user costs. We included both veterans and family members who utilized the VA healthcare system in each year. The total budget for the VA for each year was divided by the number of veterans and family members served, which gave us a value for the cost of VA care per user for each year. Correlation shows the direct linear relationship between 2 random variables. Microsoft Excel was used to determine the correlation between our chosen variables. Our results were logical. We found that patient satisfaction and IT costs have a strong positive correlation, 0.89. The closer the correlation value is to 1, the stronger the correlation is between the variables. This means that satisfaction improves as IT cost, and by implication, IT use increases. Patient satisfaction and cost of VA care also have a fairly high correlation at 0.77, meaning that there is an association between the cost of care per veteran and the patient satisfaction scores. The relationship between the cost of VA care and the cost of information technology is less strong. They are found to have a correlation of 0.40, meaning that the cost of care per veteran is not as strongly associated with the cost of information technology. Other variables that contribute to the cost of care for veterans, such as transportation, would explain this lower value. Causality is defined as the relationship between one variable and a second variable which is the consequence of the first. Literature supports the supposition that IT increases efficiency. Our team hypothesized that increased efficiency as a result of IT would increase the cost of care per veteran, but that this in turn would increase patient satisfaction. In order to test this theory, the causation equation was used. The cost of the VA care divided by the patient satisfaction correlation value is multiplied by the IT cost divided by the patient satisfaction correlation value. This is then subtracted from the IT cost divided by the cost of VA care correlation value. As the causality coefficient narrows zero, the causality between the two variables is more closely established. Based on our data, the causality coefficient for this equation was 0.29. This supports our supposition that IT cost leads to increased patient satisfaction. Graphically represented, the relationship between these two independent variables are directly correlated. This illustrates that increased IT cost does lead to increased patient satisfaction. Hence, an investment in IT would be wise as it increases customer or patient satisfaction. In conclusion, we were able to show a correlation between IT cost and patient satisfaction in the VA system. This is important because it supports utilizing and increasing IT use in order to increase patient satisfaction. An administrator for the VA viewing this set of data would be entirely justified in supporting increased use and further investment in Vista. There were a few limitations to this project. The variable IT cost was vague in that its expense within a large healthcare organization like the VA need to be justified and supported by data. In this case, the data that would be required to determine an accurate return on investment was not available on the website we utilized. The budget was also unclear as to what portions of IT were included, such as improvements, Vista maintenance, etc. Perhaps the biggest limitation of this project was the lack of exact data needed. The data available on the VA budget website had to be manipulated in multiple ways to obtain any sort of usable variables. Overall, evaluating any type of major investment is a critical component in determining the best path going forward, evaluating past investments, and determining their fiscal return. Additionally, healthcare systems or firms should show improved outcomes as related to investments.